Welcome back to Open Med School. Today I'll be discussing the major complications of cirrhosis of the liver. What is cirrhosis? Cirrhosis is the final common pathway of chronic liver injury, whatever be the etiology. It is marked by development of fibrous tissue, regenerative nodule formation, and distortion of the architecture leading on to portal hypertension. So it is a progressive liver fibrosis. So this fibrosis occurs through various stages. Let us look into it. So this is the healthy liver, followed by development of fatty infiltration, fatty liver, inflammation occurring for state of hepatitis, that development of fibrosis, and for the scarring, cirrhosis, and later many patients may go into hepatocellular carcinoma. So this is the natural history of most of the patients. So I will explain this little. So here this is the nodules. These nodules can be divided into micronodular and large nodules are called macronodular. Alcoholic cirrhosis classically produces the macronodular. The micronodular or Lennox cirrhosis, whereas the post-necrotic cirrhosis is the macronodular cirrhosis. So here shows the transformed myofibroblasts. The ito cells get transformed into myofibroblasts, and the pro-fibrogenic cytokines are released from activated Kupffer cells when there is a damage to the liver occurring. So this is the development of fibrous tissue, and this leads on to distortion the architecture of the liver. The fibrotic tissues and the nodules will produce compression on the portal vessels and leads on to portal hypertension. The portal hypertension leads on to shunting. That is, with the systemic circulation, the blood bypasses the liver and goes to the systemic circulation, and most of the manifestations of liver disease for chronic liver disease are due to the development of portal hypertension. We all know the stigmata of chronic liver disease. If you start on the hands, there is palmar erythema, clubbing, Dupuytren's contracture, there can be jaundice, the appearance of spider angioma, more than 5. The skin, that's one important thing, that is in the distribution of the drainage of the superior vena cava. Then you can get gynecomastia due to hyperestrogenism, the development of caput medusa, feminine distribution of the hair, pedal edema. These are some of the stigmata of chronic liver disease. Whenever a patient comes with these features, think about the possibility of a chronic liver disease. The burden of liver disease is increasing because of the development of the NASH or the non-alcoholic steatohepatitis or the metabolically associated liver disease, alcohol use which is rampant in the society, and the viral hepatitis. And the liver disease, cirrhotic patients, you class them using the modified child book classification. Basically, there are 3 laboratory findings and 2 clinical criteria. The clinical are Ascites, hepatic encephalopathy. Laboratory findings are bilirubin, albumin, and INR. Based on this, you classify. The child score 5 to 6 is class A, which is well compensated. 7 to 9 is class B, and 10 to 15 is class C, which is decompensated. And the survival depends upon the child class. Class A, 100% survival for the 2 years. Class B, it will be 85%. And in class C, it comes down to 45 to 35%. So that is the point to be kept in mind. That is you should try to class the patient. So this is a chart showing the values and how to class it. Albumin, ascites, absent, slight, moderate. Points are 1 to 3. The bilirubin cutoff less than 2 is 1, 2 to 3, 2 points, more than 3, it is 3 points. Serum albumin more than 3.5, it is 1 point, less than 2.8 to 3.5, and less than 2.8, 3 points. Prothrombin time more than 6 from the baseline, 3, 4 to 6, less than 4. INR more than 2.3, less than 1.7, 1.7 to 2.3, you give the 2 points. And we have mentioned how to calculate it, the A, B, and C, depending upon the total score. So, what are the complications? I have already told you, most of the complications are due to portal hypertension. So here you can see the major complications, the portal hypertension, you see the variceal bleeding, development of ascites, hepatic encephalopathy. Spontaneous peritonitis is multifactorial, but it includes portal hypertension also. Hepatorenal syndrome, the Hepatopulmonary syndrome, Portopulmonary hypertension. These are the complications mainly due to the portal hypertension. Hepatocellular carcinoma and portal vein thrombosis can also occur, which is little unrelated to the portal hypertension. So in summary, you can see cirrhosis is the fibrotic changes with the distortion of the architecture of the liver that is happening, and the transformed myofibrosis is the major cause, and the stigmata we have already discussed. So the natural history, the compensated liver disease, asymptomatic and mild symptoms, and decompensated cirrhosis, development of complications such as variceal bleeding, ascites, encephalopathy. Development of these complications marks transition from compensated to decompensated cirrhosis with a sharp decline in survival. So that is a point to be kept in mind. So remember these things. The next session we'll be discussing with each of these complications in little more detail. Thank you.